This is Andrew Kramer, Urology Associates, Cape Cod. I'm bringing you a penile implant in a man who's 80. He's been married about 60 years, obviously longer than I've been alive. And he wants to get the penile implant. At that age, I always check their dexterity. Make sure their hand can do this pump, which is not so easy to pump and squeeze and inflate and deflate. He was clearly able to. He's tall and thin, and he doesn't have his penis matches. I mean, he's I wouldn't say his girth is poor, but his length is really remarkable and tremendous amount of stretch. So we know we're going to put a pretty decent size implant in there. No trouble getting the bigger girth in. But one person told me once that the extremes are difficult, and very short is hard, and very long or very stretchy is a hard penis to measure, because you need to go very far up with a dilator all the way to get to the tip of the penis. You got to measure appropriately, which is a tricky art form of how far up, how far down, putting it together, because his penis in the stretch state, as you see there, is different from just the relaxed state there. So you've got to accommodate for all those things, and that's sort of what we're dealing with there. So measured, going down, and I think the thing that keeps the penis from being absolutely enormous is that down to his pelvis is not really so long, because he's a thin guy, so narrow pelvis. Anyway, reservoir goes in there. I think I might have showed it twice accidentally, but fill that up, pre-fill it, and then we're going to go ahead and turn our attention to putting the cylinders in. And like I said, no scar tissue at all, no corporal fibrosis. Shouldn't be a challenge getting the cylinders in. Just a question of, did we size them right? Did we get the stretch correctly? Did we get the down and the up size appropriate? And I think the answer is yes, and I'll show you my test that proves it. But I will also, at the same time, make sure that we give him a bloodless operation, as far as I can do, a painless operation, everything we want to flow, not just getting the implant in and saying, you know, hey, I'll see you in a month. I hope your pain's not too bad. I want it to be pain-free. I want infection-free, swelling-free. We want to give him the optimal situation and result. So as you see, the cylinder over there on the left looks like it's pooching out, but it's just not. It's a long cylinder, and there's nothing to keep it from sort of dropping down until you close the corpora. Now, when you close the corpora right here, then it will remain in there. It won't curl up anymore. And the other thing that keeps them from curling is when I pump it up right now, that will, like a parachute, it'll balloon the thing open, so up and down are then going to get filled out. You really depend on the test inflation to fill that out, and except for a little, I call it a left curve to a degree. Not really a bend, just sort of sloping left. Except for that, he's really got a perfect result there. Tips are mid-glands. Cylinders are all the way up, all the way down. And a gentle sloping the penis to the left. He's probably had that for 80 years, so not bothering him. So pump, low, deep, independent incision, just a couple centimeters, about an inch long. And I think he'll have an easy recovery. Andrew Kramer, Urology Associates, Cape Cod. Thank you.